What added value is there in terms of cooperation between healthcare technology assessment bodies in Europe?
You know, basically, HTA bodies in the member state face some similar challenge in evaluating the technologies, not only drugs, but medical devices and health interventions, public health interventions. So basically, we're convinced that there are a number of areas where they have interest in sharing the expertise and in pulling together the expertise, in pulling the evidence, and in working together on the methodologies so that they are better able to address the challenges in making relevant and robust decisions on access to technologies.
The healthcare sector very much is a national-driven, a sector driven by national policies. What role is there at a European level?
So you're absolutely right. I mean, we don't want to substitute and we don't want to interfere in the decision-making process at national level. That means that national bodies, national healthcare systems or regional healthcare systems will make the final decision on uptake of technologies or disinvestment strategies. What we say is that on a number of issues, specifically on clinical issues, there is again this added value in working together. Clinical issues is basically how does this drug or how does these technologies perform compared to an existing treatment, compared to an existing intervention. But of course, this clinical part of the assessment is only a tiny, it's a major part, but it's just one part of the overall HTA process. All the cost issues, the social perspective issues, the ethical issues are more for the national sphere, and we don't want to interfere on that process because here the added value of the EU cooperation is much less obvious.
Much less obvious, but still present. What can we expect from the European institutions in the next few years?
So, as you know, the Commission says, Member States, we heard your message that you want to cooperate together on a number of specific issues on HTA. We cannot support this cooperation through project. We need to have a permanent structure to work on these issues in a rigorous way and in a permanent way. This is the objective, one of the objectives of the directive on cross-border care, which foresees the setting up of a permanent HTA cooperation. What will be the scope of this permanent process? What will be the decision-making process of this cooperation mechanism? All that remains open, but at least we are successful in putting member states around the table and to invite them to see what are the benefits and the limits of the HTA cooperation. 2 years ago, there was much less interest in cooperating. Now we see the interest of member states in cooperating together. We are not looking for harmonization, we are looking for some standardization and sharing of expertise where it's necessary.